So we're taking a closer look at the pandemic in India, where new questions are emerging over the country's death toll. There's more than 1 million confirmed infections across the country, and that's right behind the U.S. and Russia. However, only about 28,000 people have died from the virus, according to the official numbers. That's quite low compared to other countries, like here in the U.S., where we've seen nearly 4 million cases and 142,000 deaths. So the Washington Post has been diving into this issue about how India is actually reporting its coronavirus cases and deaths. We want to bring in Joanna Slater, who co-wrote the article. So, Joanna, you point out that the population in India is generally younger, and from what we know about the virus, younger people get sick, but they don't necessarily die at the same rate. And you also point out that, there are large swaths of rural areas where it's just really difficult to get tested, so it's difficult to really know what the numbers are. What do you think are the factors that are having an impact on the death toll, at least what we understand to be the death toll in India?
So this is basically a really fascinating mystery about India's experience in the pandemic, right? India is one of 3 countries now that has over 1 million cases. Only the US and Brazil have reached that awful milestone. And India reached that milestone with about half the deaths that the US and Brazil did at that point in time. So the question is, why? And I would say at the moment we have a few hypotheses. The first is the one that you were mentioning earlier, that India has this demographic bonus. The population is really quite young compared to other countries. To give you a sense of what that looks like, according to the last Indian census, which is a little bit old to be fair, but still half India's population was under the age of 25. So you get a sense for just how young most Indians are. And as we know, the virus impacts older people disproportionately. And then, of course, there are questions about the numbers. And this is what we dug into a little bit in our reporting. And what we found was there are deaths that are being misreported. In other words, people who are dying of COVID-19 but are not being recorded in the official numbers. And also there are excess deaths, like we've seen in other places in the US, in Europe, deaths that we think are connected to COVID or somehow connected to the pandemic, but are not really showing up in the official figures. Now, how much of a difference that would make in India's numbers, we're not quite sure. Does it mean the numbers are higher than the official count? Yes. Just we don't know exactly how much.
So, Joanna, I guess the question I would have is, what is the government doing to help those most vulnerable across the country to get tested and, more importantly, to have access to health care should they get sick?
The government has been attempting to ramp up, like many countries. India had a very severe lockdown, much more severe than anything that happened in the U.S. All of the trains shut down, all of the planes shut down. Pretty much everything shut down in India starting on March 25th. And so the government did try to use that time to ramp up healthcare and ramp up testing in across the country. But testing rates in India remain very low in comparison to other places, including the US. And the lockdown itself was so devastating to those to poor Indians, as you mentioned. More than 100 million people were put out of work. You had an exodus of workers from cities on foot because they no longer had jobs and they were not going to be able to eat. So what the government did is it basically started rolling back the restrictions on people. And so they're hoping to somehow balance the pandemic with the economy, which is, of course, proving very difficult, as we've seen in so many places.
As you know, the way this virus has been handled has become a political lightning rod in a lot of countries. You mentioned Brazil, where their president had been denying essentially the coronavirus for a very long time until he tested positive himself, because there is an association with, how the virus is being handled and how well leadership is doing. So I guess my question to you is, when it comes to the political leaders in India, can they be trusted when it comes to the numbers, not to be politicizing it, to giving us, can they be trusted to be giving us the straight goods?
I think you're asking me a tough question about politicians worldwide. You're going to get me in trouble with whatever I answer. But let me start by saying this. So you mentioned the US and Brazil. So one important difference in India when it comes to leadership in comparison with those two countries. So Narendra Modi, India's prime minister, unlike the president of Brazil, unlike the president of the United States, has never downplayed the severity of the virus. He has never encouraged people to go about their normal lives. He has appeared in public with a face covering or a mask for months. So in that respect, India's leadership has taken this seriously from the beginning. Is it trying, like any government would, to attempt to put the best possible spin on its performance and its handling of this crisis? Yes. And I think part of the problem in India is that the data that has been coming out of the government is quite sparse. Unlike in the United States, we don't have a lot of depth in these figures on deaths, so that makes it hard to feel like you're getting a reliable picture. So we went to India's 4 largest cities and we asked them for their death figures this year to compare them to last year. And only one city gave us up-to-date, full up-to-date figures. And that was Mumbai, the financial capital that was the hardest hit city by coronavirus. And in May, compared to last year, it had 6,000 additional deaths. So the question is, only 2,000 were supposed to be connected to COVID. So what are the other 4 about? We don't actually know. So these are questions that remain unanswered, and the data to fill in those blanks is not forthcoming.
Very, very interesting reporting. Joanna Slater, thank you so much for sharing it with us. I think it really does give our viewers really good insight into how a country much larger than the United States is handling this. And I thought it was important and interesting, which it was in your reporting as well, but you said it to us, on how India went on lockdown and the steps that they took to try and mitigate the spread of the coronavirus, which a lot of other countries did too, and have subsequently seen a flattening of the curve. So it is interesting that India has not, will continue to follow your reporting out of there as well. Thank you so much.
Thank you both.